around the abdomen. It's usually the same as abdominal. So what we're having to do is take off these pants. Hoodie, obviously, with the zipper has to come off. Any shirts with buttons down the middle also have to come off, because some buttons are really opaque and will show up on your film. Okay? If you're wearing just a t-shirt, that's fine. We'll leave that on. That's no problem. Some older patients have a little more difficulty getting changed. You can have them just pull their shirt up as much as possible and let them know, and then just have them just take their pants off. Ties in the back. Pregnancy, take care of that right away, because obviously towards the bladder area, potential pregnancy, radiating fetus could cause spontaneous abortion or miscarriage. Down opens in the back. Have a seat. Take care of your console, just like we've been doing for pelvis. I forget what it is. Gen 70, 36, somewhere in that area. Okay. Set up your tune. Okay? So even though you're on that 5-minute spree, you should still be going through your routine to get through it, as quickly as possible. You should be used to it by now. If you're not practicing it as part of your, breakout sessions with your groups, you should be practicing that. So if you feel pretty good about the positions, make sure you're going through the whole thing. Make sure you're falling within the time that you can get through it without being called on that. Okay? If you get called on that, there'll be some deduction of points once you finish it up, and you will be marked out on that. Since we're doing pelvis, femur, all this stuff we went over today is going to be inside the bucky. So that means we're going to set up our centering first before you bring your patient in. Same thing we've been talking about. Move your table over. You should all know where the D10 button is by now. You have one side marked first. So center, front to back, or side to side, and the center forward, side front to back. You want to bring this across, make sure your collimation set at 14 by 17. You can do that. Just bring this halfway out. Bring this over. That's what you have to do. Okay? So when you do this, the natural tendency of some techs when they get the patient on here, especially if it's a big patient, is they will open this up a little bit. Okay? If you open it up, you're going to be past the lines that you can use, past the usable limits. Okay? It's not going to help you. It's only going to throw off your collimation. Okay? Throw off your centering as well. Okay? It's marked. So set in transverse. Down the middle. Marker. Down low. Okay? So a lower outside portion. Usually you use your right marker because that's closer to you, assuming your patient's going to lie to head down this way. Slide in there. That might be a little thick, so I have to take some of this stuff off eventually. Okay, so lined up, centering's all set. Okay, so all you're going to do is do the table. There, come on in. Grab this, lie down on your back. Get over. You bring your table up, okay, or hat it up, whatever. That's going to adjust the size of your collimation as well. So if you want to move this up a little bit, you're going to have to move this up correlatingly to keep your collimation the same. Okay, so on the table, just bring your hands up on your chest. You want to make sure he's in the middle of the table. Okay? So if you look at him, he's lying at a little bit of a diagonal angle. Okay? So you can either adjust the pad that he's on, or you can just move him over so he's in the correct position here. So let's move this leg out a little bit. Move your shoulders over a tiny bit. Eyes a little bit more aligned on the table.
APPelvis?
APPelvis, yes. So what we're going to do is on this side here, you're going to find his ASIS first. Which is right here on top. And you're going to follow it around, just like the abdomen that we did second week of school or whatever, or third week, whatever it is, okay? Find the crest, which is right here. My finger is, make sure the light's just slightly above that, okay? Once it's above that, then you're pretty much set top to bottom here, okay? The only thing you need to do is center side to side now. That's when you put both fingers on ASIS on both sides. And then you just measure that off from there. If it looks like you got equal light field, either going here to here or here to here, equal on both sides, then you know he's centered down the middle. So we have it centered side to side and top to bottom. Fine. Okay, so it's all set there. What we're going to do is we're going to put our shield on. Okay? You can put this on a couple different ways. For guys, we're going to be putting it on like this. Okay, so we're using this kind of sharp edge right here. So it's going to be up and down like this. Okay? For women, it's going to go like this. Okay? That's the way it should be on there. It shouldn't be upside down like it is on that film there. Okay? So we're going to assume you're a male patient for this one. What you can use is you can either use the symphysis pubis here, or you can use the greater trochanter. If you want to use the greater trochanter, all you have to do is put your finger along the outside, rotate the leg in and out until you find that greater trochanter. And you can find it because it's a significant structure. It's going to flip around your finger going both ways when you abduct and adduct the foot towards the outside. Okay, that should correlate along the bottom of your symphysis, which is right about there for females. For guys, symphysis, a little bit of pressure here. Right here, put your shield just sitting on top there. I'll put a piece of tape or whatever to hold in place. You can do that. It's fine. Okay? But it should just rest on there. The only thing we got to do from here now is we're going to bring our feet apart, toes in together. Okay, abduct it in about, I think it's 15 to 20 degrees. I think is what I said on there. Okay, these have to be turned in. If these aren't turned in, it's a repeat. Okay, because the lesser trochanters aren't going to hide behind there. Okay? Some people can rotate their feet in without moving their femurs very much. Okay, so when you're in the clinics, you want your patients to do, have them turn here and squeeze the thighs in towards each other and push this in. It makes it a little bit easier for them. Okay, so they're engaging their bigger muscles rather than their weak muscles along the posterior portion on there. Okay, so these touching, shield on. This is below the level of the diaphragm. So I'm going to take a deep breath in, blow it out, all the way out. Stop your breathing. Breathe, relax.
I just want to see how much light.
Questions on the pelvis? Okay. Now, if you have a female pelvis, what you're going to be doing is you can still use the greater trochanter, okay, to find the inferior level of this. There are usually 3 sizes to this. Okay, generally it's going to be the middle size that you're going to use for most patients. You know, if you have a pediatric patient, obviously the small one. The big one I almost never have to use. Okay? But this mid-size one is good for most patients. It sits within most female bladders pretty well. Okay? So all you do is find the greater trochanter again. So I'm going to rotate this in and out. Okay. So symphysis right here. That's where the bottom part of this border is going to be. Okay? You can check 2 spots. You can check the bottom part where the symphysis is, or the top part is going to usually align with the ASIS. Okay? So the ASIS is here, and you go across, you draw a line across there. The top of this shield should be just below that line, okay, or buried, buttoned up against it. Okay? As long as you're on that, this part will usually take care of itself. But you can use the symphysis and go up that way too. As long as you're along the top border of the symphysis, the superior part, then it'll be properly positioned there too. Okay? And then it's just a matter of getting it midline. So for him, about right there. Her, about right there. Okay. Again, toes in, breath in. Make sure the shield doesn't slide off to the outside. You know, breathe in. They got a big belly. It slides off the hip. And you got a little problem. Okay? Most people are pretty flat against there though, so they'll stay on there. Okay. What I don't want you to do is go shield. Hold your breath, don't breathe. Okay? Make sure you use your arms here. Okay? This is not an actual patient, this is just a student. So, you know, find the symphysis, you know, because I'm gonna go in there, I'm gonna find the symphysis, and if your shield is above that, a little pressure on your bladder. Just above that, then I'll know it's in the right place. The guy, and just below that, then I'll know that's in the correct place too. Because if you don't find the symphysis, you are probably not going to use a shield. Okay, and I can say it as much as as I want. But the general fact is, if you're not comfortable doing that, you won't use a shield. Okay, because be like, I don't want it to get in the way. I don't want to have a perfect pose and have to repeat it. It's just because my shield's off a little bit. Okay? But if you work at it, you know, and you understand the anatomy behind it, then you'll be able to shield pretty comfortably without any problems on there. Okay? But you do have to understand the anatomy on there. Some people are just too lazy to get it. Or some people never learn as students, and they never kind of venture forth to kind of figure that out on their own. Because I didn't learn this as a student. I learned this as a tech after a while. I see the pictures, I'm like, what is that thing on there? It's a shield. How do I get that on there without it being in the way? A little trial and error. You know, look at the anatomy on female versus male pelvis, and then you can figure it out. I had no problem finding the synthesis, so it should be easy to get in the right